All right, welcome everyone. My name is Dave Sainer. I'm head of public safety partnerships here at Rapid SOS. I'm so glad that you're here to spend some time with us during this Ready23 event. This specific talk will be about overdose detection and bridging the gap in the opioid crisis. For those of you that are just joining, this may be your first session of the day. I want to just give you some background. Rapid SOS Ready23 is hosted by Rapid SOS. And so if you're not familiar with Rapid SOS, we are an intelligent safety platform that securely links life-saving data to monitoring centers, to 911, and to field responders during emergencies. And so this event, Ready23, it's really to foster a sense of unity and bring together all these great minds, partnerships, and really explore the challenges that we're facing and the problems that we're trying to solve. And it's really based on this community. The feedback that Rapid SOS receives and that our partners receive just really helps make our products and services better. So continue to hit up those chat rooms. Please provide your ideas. All ideas are good ideas. Your feedback, whether it's harsh or incredibly positive, we want to hear it. So please participate in those manners. So today, I'm joined by a great panel. Really looking forward to this discussion. It's really unique for me. I had the opportunity to moderate a couple of different sessions today. This one just is really intriguing to me because it's looking to help improve outcomes from a way that I never really thought of, and I think a lot of you it'll open your mind to the challenges that are out there and how there are solutions that are really such as what the Brave Cooperative brings that are addressing the problems upfront and head on. So without further ado, I'm going to allow for Gordon Casey, CEO of Brave Cooperative, and Chris Halliday, who's a district manager at I'm Responding, provide a little bit of introduction on themselves, background on themselves, as well as just to speak about how their companies and how they address emergency response in today's world. So Gordon, I'll start with you.
Thanks, Dave. Gordon Casey, the Brave Technology Cooperative. I'm here in Canada on the unceded and traditional territories of the Musqueam, the Squamish, and the Tsleil-Waututh nations. And in case anybody is curious what unceded means, I had to learn when I moved here 7 years ago. Unlike most of North America, the indigenous folks here never signed any kind of treaty with anybody. So this land, I guess it's like it's really illegal. There isn't any kind of document saying that the government of Canada actually should be here. So here we are, also known as Vancouver. I have a background in law and finance and was doing that for about 18 years, living all over the world. My accent is weird. I'm from Ireland, but born in Africa and raised in the Middle East. And at a certain point, I wanted to do something that I give a shit about. And excuse me for my language, but that's what it came down to. And I love technology, and I love the potential of technology to take solutions that might work in one place and just see whether that could work for a bunch of other people. And that's what Brave is founded on. So I moved here to Vancouver, saw the overdose crisis happening on the streets, like literally people dropping on the streets where I was in the downtown east side of Vancouver, and started asking people like, hey, what could technology bring to this challenge? And Brave was born. And it's a co-op. We're owned by the people who work here. We're owned by the people who use the technology, and we're kind of different as a technology startup in a lot of different ways. But I'll get into some more of that later.
Great. And Chris?
Hey, thank you. So my name is Chris Halliday, district manager with I Am Responding. I actually have a background of have been a firefighter and a paramedic for the last 22 and a half years. And part of my role as a firefighter and paramedic, I actually took great hold to the whole area of community risk reduction, which included not just fire prevention efforts, but also efforts in trying to address this crisis, the opioid crisis. And that came about for us in a very personal way, in that we had a teenager in our district who died of an opioid overdose. And that led us down the path of trying to figure out, how are we going to solve this problem, and what can we do to resolve this problem? And our department looked at it in a number of different ways. and have been trying to bridge that gap on how to educate young folks about it. When I came to my retirement from the fire department, I Am Responding was a natural fit for me to go in that next step because of everything that they do and everything that they stand for. And we'll talk a little bit more about how I Am Responding, utilizes its technology to help first responders with these types of calls as we go through our session here.
Excellent. Thank you for that background, both Chris and Gordon. For those of you in the audience, really appreciate you being here as well. So this discussion today is really going to center around how 911 and field responders can leverage emergency data from specialized applications to reduce response times and enhance situational awareness. The first question I have for the panel today is actually directed to you, Gordon. And if you could please tell the audience about the Brave app and how it supports its customer base. And then from there, I have a follow-up question for you as well.
Yeah, sure. So the app is one of three tools that we have available, and it's really centered around this concept of overdose detection. So, and this is new for a lot of people. Here in Canada, we have supervised consumption sites, which is where folks who are using drugs, and initially primarily injection drugs, but people who are using any kind of drugs can go to that place, it's a physical place, and use their drugs in that location. There's nurses and volunteers and social workers and peers, people with lived experience all around to ensure that they stay safe. And then, if they're done and they leave. And if something happens, those folks are on site. So they're administering oxygen, they're giving naloxone or Narcan if needed. But the Brave app is that via a phone, right? Via an app. So you download the app, you push a button, you get connected with a volunteer, usually somebody with lived experience, either of substance use, but definitely of overdose response. So they're familiar with what's going to happen and what an overdose looks like, or in this case, sounds like. It's not video, it's just voice. And they stay with that person for the average 22 minutes that they'll be sort of getting ready, using, and then staying on the line for sort of 5 to 10 minutes afterwards to make sure that nothing happens in that space of time. And if something goes wrong, then they're connecting them with response.
Fascinating. That's it's such a unique capability, unique service that's being provided. And what I think I really appreciate about it is that this is not trying to hide the fact that we have people that are addicted to these opioids. So how can we make that a safer situation and also inform the field responders or those that are in the building, as you describe, understand what the situation is, how they can really save that life. So, and for that matter, it really makes me think about, the variety of use cases that this space, the public safety space, has been talking about over the last several years. And this one's just so unique. We've talked about next generation 911 and the various data sets that and use cases that will come to life with next gen 911. And it's often said or viewed as kind of it's the next iteration of ALI. And for those that aren't familiar, ALI is the automatic location identification. That was built on the wireline telephone network. Very, very regimented set of data. It's an address, it's a customer name, it's a description around the call type, things along those lines. But we've grown up from that. We as a society, we have so much sitting in these devices on our phones, in our homes. It's a connected society. And we as a public safety user community need to really move beyond what has historically been there and helped us be successful. But all this other data can really help provide context and situational awareness that we may never have dreamt of, like the Brave Cooperative. This is just a fantastic partnership that we have, and I really appreciate that there's this service that's available to those that need it. Anyhow, enough of me talking about that, but Chris, I'd love to get your perspective on how the availability of more data helps you respond more effectively to emergencies.
Yeah, absolutely. So, on the first responder side of things, certainly you had mentioned that location data, and that's going to really be key for our first responders, especially for anybody who's maybe utilizing the drugs or getting high in an area where they're not familiar with, or they're not exactly sure where they are, or they just aren't capable of determining where they are because of the state of mind that they're in. And so that location data can be essential for first responders in finding where that person is when they call 911, and being able to respond to that in a timely manner. The other component to it is the health data that's right on their phone. If they do take the time to fill out that health data on their phone, that they make that 911 call, that health data can actually come through the Rapid SOS system and come right out to the IM responder, through IM responding to the responders, so that you can have some background on who this individual is. So by the time we get to that call, if the person is unconscious and unresponsive at that point, we would then have some health history on them and be able to actually know a little bit about this person who we're going to treat now, and have some information on what we maybe shouldn't do because of allergies or because of previous history. And then lastly, data-wise, keeping that data, having a management system where you can keep data about the calls you've been on, being big in the reduction, community risk reduction and prevention and education side of things. For me, being able to look at historical data and geographical locations and using that data to try to help us determine where we have to target areas for education and preventative efforts moving forward.
Very good. Gordon, from your perspective, and that's the perspective of the data in the hands of those that are responding, but I'd love it if you could share some insights as to what 911 telecommunicators should expect when a Brave volunteer contacts 911 on behalf of one of Brave's customers.
Yeah, so in addition to the sort of data package that we collect from the callers, which is in the form of what we refer to as their rescue plan, which will have where they are located, what floor, how to access the building, all of that, which is just sent immediately through your clearinghouse. The volunteer is somebody who has like way more experience than most folks in both responding to overdose and in terms of connecting with 911. So they're all trained on like how to approach one of those calls, how to communicate what's going on clearly and efficiently to ensure that they are like being empathetic to the operator, and that they know what kind of information they need. But they know what an overdose looks like. So they might have been they might have overdosed themselves. We have a lot of folks with lived experience of substance use, and but as I said earlier, they definitely responded to overdoses in their community. So they're first responders in another way, right? They're community first responders. They've been on the scene, and so they can definitely just offer this, like in our view, it's like more experience than you'd expect to get from somebody who's calling in a 911. They're making a 911 call.
Yeah, interesting. I just kind of made a connection too that we Rapid SOS and some of our other partner segments are monitoring alarms and monitoring sensors and connecting with the human, potentially the human on the other end, or at least assessing that information to try and filter out the false alarms to 911. In this situation, it's a very similar situation from the standpoint of understanding that this is a situation that needs to be escalated, and being able to provide that value add information to the first responders, and that's that 911 call taker dispatcher. Chris, next question for you. What kind of tools and technology are instrumental for you in your efforts to support the community?
Yeah, so I'm going to start that off with kind of chiming in a little bit on that last point about, sometimes these folks are calling in 911 for themselves when they're overdosing. One of the last overdose calls that I actually went on as a paramedic was called in for 21 female overdose, unconscious, unresponsive, not breathing. And by the time we arrived at that call, there was actually 2 people unconscious, unresponsive, and not breathing. And what we learned after the fact was that it was a mother who was calling for her daughter, but what she didn't mention was that they were both addicts. They were both users of heroin. And the drug is so powerful, and it has such an addictive nature to it that She had actually told her daughter, like, you go ahead and take the drug and I'll monitor you. And when she went unresponsive and stopped breathing, she called 911 and then took the chance, knowing that we were coming, that she had such an addiction that she injected herself with the drug after that, and actually went unresponsive and stopped breathing as well by the time we got there. So it is such a powerful drug. And so leading into your question about technology that's instrumental, right, is that this caller has made this phone call to 911, has now injected herself and has become unresponsive and isn't able to continue to provide any additional information to the first responders or to 911 about location, exactly where they are, what the area, what we're going to encounter when we get there. So really comes down to that location tool that Rapid SOS provides into I Am Responding. First responders with I Am Responding being able to see exactly where that caller was, so that if they are still connected to 911, they go unresponsive, they're still connected. We're going to actually be able to see where exactly in a house, behind a house, in the backyard, where they're located, and be able to get to them seconds or even minutes faster than we would if all we had was an address and we're knocking on the door, looking all around the particular property, looking for that person. So that's really the most important, the vital tool that we need through I Am Responding and Rapid SOS to find those people quickly and to be able to start to render aid for them.
Yeah, it's those emergencies don't happen at the doorstep of that address, and it's always great to see the different success stories, save stories, where that address gets them to the starting point on where the real emergency is. And I can see where as a field responder yourself, that it's just got to be reassuring for you as you approach a scene.
Absolutely.
Okay, thank you. Gordon, there's a lot of different people that have quoted that knowledge is power, or information is power, and Rapid SOS's mission is really to empower dispatch and field responders with information, and it needs to be the right information at the right time so that the right response can be made. 911 telecommunication field responders are also incredibly empathetic individuals, very committed to their mission. And I'd love for you to share from your perspective, and that being a perspective of a CO who serves this at-risk population, what knowledge would you like this audience to have about the opioid crisis? And I think that'd be incredibly insightful.
Thanks. You might need to interrupt me. I could go on this one.
Please.
We did a design jam around our tools back in 2017, and there was one of the people there was an ambulance paramedic from an ambulance, and one of the people that was at his little breakout group was somebody who uses drugs regularly and still and injected fentanyl already at that time, and he ended up in tears at the end when he was sort of offering some feedback, and he said, like many people in my profession, like I suffer from compassion fatigue, and there's many times when I've been out and responded to an overdose that's the same person that I reversed the overdose earlier in the day, and that's hard for me to keep caring as much as I would like to. So, but I've never had the chance to sit and just have a conversation with somebody who uses drugs. And so he was saying, to understand the pain that this woman, Erica, goes through on a regular basis, and why she needed to, in her words, self-medicate using heroin or fentanyl, using opioids, and to understand the stigma that she felt, which would prevent her from ever asking somebody else to call 911 on her behalf, because she feels guilty about it. Like she's not, she feels that she does not deserve this kind of care and this kind of support and so on that paramedics are offering, that 911 offers, and that Brave is offering. And it was so potent for him that it really sort of changed things, and we're sort of still in touch, or we stayed in touch a little while after that. So I think just that, like the stigma is so powerful, And this crisis, this overdose crisis or opioid crisis, it killed over 107,000 people in the US last year. I believe it's still the leading cause of accidental death for Americans. It's crazy. And until everybody who uses drugs, and whether they're addicted or they're using it casually, but they all feel like it's not, like they're not worthy, right? They all feel they don't deserve care and resuscitation, and you read the comments on some websites, you'll see that they have reason to feel that. But we don't. We revive people who are drinking from cars that are crashed. Like, we get the jaws of life in there. We think everybody deserves to at least live the next day and then see what happens next. But until those folks believe that, this crisis is just going to continue unabated. Last anecdote, like we have people who use the app because it does kind of blow people's minds a little bit when you talk about it. And we have people who use it who the first time they call in, they cry, like just without having done anything. They're just like, wait a minute, like don't call. I'm okay. You're not calling 911. We assure them we're not. Like, we're going to help them. And then when they understand that the app is exactly how it was described on the website and what they learned, that brings them to tears because they have never seen anything like that. Anything as unconditional or caring as that. So.
That's powerful. Thank you for sharing. Let me let's see. We got about 9 minutes. Let me jump over to see if there's any questions. I think we've addressed a little bit, but I want to make sure that see if this question could get it answered. Maybe have you address this for us, Gordon? And that's how can we detect overdoses and with enough time to save the patient? And I think this may be a good opportunity for you to explain, really what's being done by the Brave Cooperative.
Right. So overdose detection for us means anything that's designed to sort of keep that person connected in some way. So if you use drugs alone today and you overdose, then you're going to die. And that's 85% plus is how folks who are dying from overdoses, that's how they're dying, is because they were alone when they were using, or they were with somebody who was possibly too scared to call 911. So there's so many tragic stories of people using together, where somebody uses and then everybody bolts because they're scared of the consequences of if they call it in themselves. So the different ways that we do it are with the app, so that we have these experienced people on the other end listening in to make sure that they can immediately make a call. They activate 911 response. They can also activate community response. So friends or family, like potentially the mother downstairs, like we have kids calling in from the bathroom or from their bedroom, and their emergency contact is their mom. They would never tell their mother that they're using opioids in the house, but they're okay with their mom being told that they need to come upstairs and reverse the overdose. The other tools, we have a sensor, so we have a sensor that will detect if somebody stops moving. We have buttons for supportive housing, where people, similar to the app, like, will push a button to indicate that they are using drugs and that they need somebody to come and do a check. And so it's not a panic button, it's like a I'm at a risk button. So again, similar to the app. And we're working on a wearable. But as you know, I know you all know that, like, seconds count, right? So it's about trying to get as close to the point as possible. But we're also super conscious that we don't want to be triggering false alerts or sending ambulances and paramedics running all over the city. So that's why we always try to have another human intervening. In the app, that's our volunteers. So they're on the phone with the person, versus that just being an app that's a timer or something like that. And with the buttons, it's the staff at the supportive housing. And with the sensor, it's the librarian or the coffee shop barista, somebody who can intervene and check, rather than those signals going direct to the PSAP.
Very good. Thank you for that. I have one more question for you both, and Gordon, I'll start with you, and then Chris, have you answer, and that's pretty open-ended. So take it where you'd like. How do you envision the evolution of emergency response technology over the next decade, and what opportunities and challenges do you foresee?
Ooh. I mean, what I would love to see is a more. I'd love to see more community responders engaged, and I know that there's a bunch of cool tech out there doing stuff like this. But a national system that the rest of us could sort of sit on top of, so that kind of framework, versus what I see right now, the folks who are doing this, the brave folks who are doing this, is they're having to build everything from the ground up, right? and that's hard. But I know so many people who like have naloxone with them, but also have like their like St. John's Ambulance or American Heart Association credentials, and they're just like ready to respond. Um, as we would be with Rapid SOS, but just getting that community engaged and connected. I'd love to see more of that.
Love that. What are your thoughts, Chris?
Yeah, I definitely think emergency responders embracing technology, utilizing technology to their advantage. As much of it as that's out there, the emergency responders themselves can't be afraid of it and have to take it and use it for their advantage. My vision, hopefully, is that we're going to be able to continue to increase things like monitoring devices and have them connected to programs such as Rapid SOS, I Am Responding, that it'll provide faster information to us, more accurate information, and we'll be able to utilize that to respond faster, get to somebody's aid a lot faster, and certainly save more lives.
Awesome. Well, Chris and Gordon, I really appreciate the discussion today. You both gave opened my mind to the needs of our communities, and really love that community response answer that you had, Gordon. I think that community response is just going to bring our communities closer, and there's no time like the present that we need that. But thank you both for your time. Really grateful that you're part of the Rapid SOS Ready community. And to the audience members, please enjoy the rest of Ready23. Get out there and enjoy the chat sessions and engage in those different blogs, or pardon me, the different questions and different entertainment areas that we have within the Whova app. But really appreciate everyone's time. If you have any questions, would like to engage with me, please feel free to email me. My email address is simply my first initial last name, so dsainert@rapidsos.com, or feel free to reach out to me via LinkedIn. Hope you all have a great day, and thanks for being here.
Thanks.
Thank you.